I think that Bangladesh is becoming a more Western country according to the lifestyle and to the needs of the population. So there are some little difference compared to Western world, but the main 5 types of cancers are affecting also your population, like for instance, lung cancer, breast cancer, prostate cancer, and last but not least also all GI cancers, in particular gastric cancer, which seems to be a very important issue also for Bangladesh. The trend is an evolution for many cancers, and I believe that going to the second question, that the prevention is absolutely important also for you, like in every part of the world. You have a different diet, you have a different way of living. I think it's important to understand what are the most critical factors, like for instance cigarette smoking, or certain type of food, like the presence of certain type of meat or processed meat, of excess of salt in the diet, and physical activity. These are the crucial points you have to, also the population in Bangladesh has to start somehow to follow, so to try to reduce the incidence of certain type of cancer. Besides prevention, there is also other aspects. There are other aspects you have to look after. For instance, the early diagnosis and the improvement of all the means to achieve an early diagnosis, like good diagnostic techniques, good facilities, centers for everybody. So this is the few things we can do to improve the outcome of oncology disease. How is the Congress? How do I feel in the Congress? The Congress is quite interesting, and I was really surprised to see the enthusiasm, especially of the young doctors, the young researchers from everywhere of this part of the world, but especially from Bangladesh. I was in the jury for judging the 10, I remember, work presented by young doctors, and it was very, very interesting. I think they did a good job, and they are very close to our standard in the Western world. So I really encourage to go on this way, because it's really an important job that they are doing for themselves and for the rest of the population in Bangladesh. I know it for young doctors, young medical oncologists, is an hard work. Something is new, it's a big effort. There are many psychological issues, it's a busy life, but at the end of the day, good research is always an important satisfaction in the career of everybody. So I really encourage them to keep doing this good job they already done. Advocacy and knowledge management, yes, of course, is very important also in the treatment, or in the management of cancer patient. A good organization is a basis for giving the opportunities to everybody to achieve, to be treated with the last opportunities, last treatments. Although there's a big issue also for this country, not only for this country, but also for my country, for Italy. Many of the new oncological drugs are very expensive, because they come from a long process of approval, of clinical trials. So all the new drugs, starting from immunotherapy and biological and targeted drugs, are really very costly not only for the individual, but for the society. No matter if it's a public or private system, it's an important, it's really a crucial issue to reach everybody. It's very difficult, and this is crucial because for many tumor types we achieved a very, very important result with the new treatments, like for instance immunotherapy or biological drugs. But unfortunately, this is not easy for everybody to be treated with the last discovery of our sciences. So let's hope in the future there will be a collaboration between countries and between organizations and medical associations and companies. We don't have to forget the role of the companies. And they play really an important role because all the new molecules comes from the research that has been done by the companies. There is a group of stakeholders that they have to work all together to fight cancer. This is the real future.